It's all yours.
Thank you. Well, as our congressman has explained, there is the new insurance part of reform, but there are two parts of reform. There's healthcare insurance reform, and there's healthcare delivery reform. On the insurance reform part, Blessing Health System, as a major employer in this community, has worked very hard at remaining knowledgeable about the causes or the changes that are being caused by the new legislation. And they are major, and they do affect us as an employer. They affect us as an employer and a provider. As an employer, we've made the changes required in our self-insured health plan and incurred the costs associated with those changes because we had to include additional benefits. We have new transitional reinsurance fees to a fund to help offset imperfect loss or ratios within pools. We have the increased cost of stop-loss insurance because we have no annual or lifetime maximums in our health plans anymore. And we have the additional cost of the health plans itself. So we are seeing an increased cost in our insurance plan for our employees, which the employer bears part of and the employees bear part of. So even though our employees have an employer-sponsored plan, they are increasing their cost also. As a provider in healthcare, we've provided much education to our internal and external constituents, helping them understand what this health insurance marketplace was all about. We've participated in the in-person counselor program to make sure we had people available to try to explain what was going on. And we've attempted to estimate increased reimbursements we may see from the people going into the health insurance marketplace and getting insurance or going into Medicaid because of the expansion of Medicaid in Illinois, and the reduced reimbursement that we might see because of what our congressman has just explained, the cost of insurance going up, people not having insurance that used to have insurance, and people moving to high deductible health plans and then not having the financial capacity to pay for their high deductible part of their cost. We're having a very difficult time trying to figure out what 2014 is going to bring because we have so many moving parts. So all we can say is 2014 is going to be a roller coaster, and we're going to have to wait and see what happens and how it's going to affect us both clinically and financially. On the delivery reform side, though, there's the other part of it because we are both an employer and a healthcare provider that has to deal with that side of the regulation changes. The market pressures that have been around because of the escalating cost of health care being provided in the United States has initiated an evolution in the healthcare delivery system. Specifically with hospitals and doctors, we're having to change how we're delivering care. Associated with the goals of the Institute for Healthcare Improvement, which are 1, improving the patient's experience of care, 2, improving the health of populations in general, and 3, reducing the cost per person of care, which are all very good goals, providers are actually seeing a shift in how we're being reimbursed. We're moving from a fee-for-service reimbursement system that we've had for a long time to a value-based reimbursement system. What that means is we are now having a part of our reimbursement from different payers, Medicare, Medicaid, commercial insurers, going at risk for the quality outcomes, utilization outcomes, patient satisfaction outcomes, and cost outcomes that we achieve based on the care that we're providing. Many believe the end point of this evolution of reimbursement in the United States will actually put providers at full financial risk for the health care that they are delivering. Now, as this shift in financial risk occurs, providers will not only be responsible for delivering high-quality health care, they will become responsible for managing the overall cost of the care that they're delivering to patients or populations. In essence, they will become both the provider and the insurer. A brand new world which we don't know about. We've focused on delivering quality health care, not insuring health care. So we have a lot to learn, and we're trying to learn very, very quickly. Providers will find ways to lower costs by becoming more efficient, becoming more effective in the way we deliver care. That's all very, very good. And in fact, some positive examples of that are using electronic means, electronic health records, electronic information exchanges to move patient data from provider to provider so that duplicate testing doesn't have to be done. Using care coordination to help patients as they try to navigate the complex healthcare environment, as they need help with their chronic disease management and helping them make sure they get their prevention and wellness things. That's all very, very positive. And additionally, using evidence-based protocols to make sure care delivery decisions are consistent and they're based on evidence. They're science-based. In essence, you hear getting the right care at the right time at the right place. We'll do a better job of that, and that's all good. And the term being used for all these things that I'm talking about is population health management or patient management. That's our new word of the year. Now, a potentially negative part of this new world of healthcare delivery from a consumer's point of view is if in fact we're going to become responsible as providers to improve health so that costs can be reduced or manage care better so that we can reduce the risk overall, the financial risk overall, one of the outcomes is likely not only are you going to see higher cost in your healthcare premiums, you're probably going to see narrower networks. The in-network providers are going to get smaller and smaller because you've got to control that cost a little bit more. So that's another side. And that affects how we work as healthcare providers, and it affects the consumers, the patients, based on where they're going to go get their care. The evolution of healthcare management by providers will change our relationships with our patients, change the relationships with employers, with insurance company, with the government, and some changes will be seen as positive, but many changes will not be seen as positive. In the end, for us as an employer and as a provider of healthcare, when we add up the changes that are being made in the insurance side of things and the changes that are being made in the delivery side of things related to healthcare, we think this evolution might in fact be a revolution for healthcare, and we are having to put so much energy and time into trying to figure out how we do this and how we're going to deliver care in our community and continue to be successful so we can continue to deliver on our mission within our community. It truly is changing how healthcare is being delivered and paid for in the United States.
Thank you. Thank you for the thorough explanation of how it will affect the hospital. She's exactly right, and got into some more details as far as those that go into the exchange. As someone who has to go into the exchange, the law requires that members of Congress and their staff be in the exchange. I was interested to learn that I'm no longer considered an Illinois resident for the purposes of my insurance. The law not only requires me to go into the federal exchange, but I have to go into the Washington, D.C. exchange. And what that means is that my current Illinois physicians and the current Illinois hospitals will be considered out of network and will cost me a significant amount of out-of-pocket dollars if I want to continue to see my current doctor. So, lest you think I have a gold-plated plan, let me assure you otherwise. Eric Thomas from ETC Computerland. Thank you for hosting.
Yep, thank you. Yeah, first of all, thank you for coming down, Congressman Schock. Thank you all for being here and put in such close quarters, so we don't have the exact perfect stadium seating for you. But yeah, although the ACA doesn't necessarily affect us directly, as we are under 50 employees, you know, we are constantly here in growth mode. I've got a lot of, told many of you, but I got a lot of debt to pay off from when we bought this business back in 2007. So we are constantly in growth mode, and with that, with increases in healthcare, last year before we made some slight adjustments to our plan, it was going to go up over $12,000 in a single year from 12 to 13. And so, and another indirect effect that it had on us was this year we actually didn't have to, but we did renew before our normal renewal date of April, which locked us in to, I think as Connie referred to it as the roller coaster that will be 2014, that at least locks us in until December 1st of next year. So can't wait until that happens to see what happens on that. So, and the other indirect part of this is, yes, sure, I could probably not offer insurance, but I already compete with a number of large employers and small employers in the area, not just Quincy, but also St. Louis, Springfield, even Chicago for that matter, that without offering insurance, there's no way that, you know, I wouldn't be able to keep my awesome people. So, with that, that's really all I have. Again, thank you. I think we've got water, cookies, and other stuff in the back, so I'll stop.
Great host. And we'd ask Jim Rubatten from Knapheide, who we all know is a great truck manufacturer here in Quincy for more than 164 years.
65.
165 years, uh-oh. Don't tell Matt that I made that. Come forward and tell us a little bit about your experiences.
I'm responsible for human resources at NAPIDE and had the privilege and been blessed to be able to be with NAPIDE for 24 years. In those 24 years, from a recruiting standpoint, we've never had an employee, whether we recruited nationally for vice presidents or a welder, say, I don't want your job because of your health care benefits. With the new legislation, all of a sudden, they're telling us, okay, you got to add this, you got to add this, you got to do these kinds of things. Next year, 2014, we're going to have a assessment of $183,000 to, it's a long name, but basically it's to pay for, to help others that don't have coverage, but that's $183,000. NAPIDE pays, after we take our employee contributions out, NAPIDE just for the local area will spend over $8 million in health care. And then you tack on the things like $2 assessments per employee that TPAs want to pass along. Our broker who helps us manage our healthcare system says a minimum, the regulations will cost us a 5% minimum increased cost just for the new legislation. NAPIDE can't pass those costs along. We love to say, okay, ding, 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 we'll add that up, and that AT&T or those corporate customers that we have will be glad to pay us more than that. In fact, they today come to us say, we'd like your business. Had a major fleet come in and say, we've enjoyed you doing our business, but we'd like for you to reduce your prices 5% next year. We don't care about your health care costs. We don't care about your energy costs. We don't care about these costs. We want our costs lowered. So it does have an impact. Now, let me just step back real quickly from the personal side. Take the step out of the corporate. I think probably most of us in this room serve or go to church or serve on agencies of some sort. At the church I attend, I'm a chairman of our pastor parish committee, and we have one secretary that's full-time, and she came to me about a month ago and said, hey, Jim, my plan's canceled. And I was talking to her last Sunday at church. Well, okay, we've got another plan. Well, the plan means her deductible's going up 3 times. It's a catastrophic plan. So you look at the premium might be close to being the same, but for her, now she's got a triple deductible, she's got lesser co-pays, all those kinds of things. So it's just not in the corporate world. You look at the NAPIDEs, the State Farms, the Caterpillars, yeah, are we going to go out of business? No. But it still impacts us on our costs. But more importantly, it's the people that we shop with, we go to church with, all those people that are being affected by this legislation. We'd like to see the congressman do all he can to help us out there.
Will do. Thank you. Appreciate it. And finally, we'd ask Jeff Kennedy from the Kennedy Wealth Group. Welcome.
First, I'd like to say thank you, Congressman, for coming and speaking to us in the district here and allowing us to be heard as well. And I'm really glad to have the opportunity personally to implore you to get this government out of my way. I mean, it's really frustrating. As a former fighter pilot, I'm not used to being out of control of my life, but I feel out of control because I'm one of those individuals who got the cancellation letter. I've been in the business of health insurance for over 10 years, so I understand the industry pretty well. And I've seen rate increases over the years, and I expected this was going to go higher. But my rates as an individual, and I've been providing my own because I'm a small business owner, self-employed, I've been so for over a dozen years. I pay my own premiums. I pay my own deductibles. Everything's on me to provide for my family. Since the Affordable Care Act has gone into place, as it's being called, my rates have gone up over 250%. And this letter I got was, it feels a little bit like perhaps a Saturday Night Live skit or one of the old Far Side cartoons or something, I'm not sure, because my premiums for a similar and benefit plan more than doubles my deductible, adds all kinds of per occurrence co-pays for maternity, which I can assure you we don't need anymore, and surgeries every time I go get a prescription, everything. I've had a high deductible health care plan for a while, which has worked very well for my family. We contribute to the HSA. That's been a great plan. We rarely draw on it. Well, this year we drew on it. In March I had a big surgery. I had cancer. And I blew through that deductible in a hurry, but thank God the coverage was there and it worked well for me. I want to keep what I have, and this the one that blows my mind is the lower cost option that's offered here is actually 81% more from my renewal in just June. So I'm really thrilled that I had the opportunity to share this time with you. I sent you an email last week, didn't know if it would get anywhere, but I'm one of the little guys out here, and we thank you for fighting for us.
Thank you. I don't think you look that little.
One of the other things I was going to say is the rate increase that I'm getting. I'm growing as well, Eric, and I'm trying to hire someone else. I need to hire someone else, but that cost is about 3/4 of what I was intending to pay in terms of a salary to a new job that I'm trying to create here. So it's significant. It doesn't just affect me.
Yeah. No, there's no free money. And so even when the administration says, well, log on, you can get a subsidy. The reality is that the subsidy is paid for by those who aren't receiving a subsidy. And at the end of the day, if people who don't receive subsidies, health insurance premiums are going up naturally, they're not only going to have to pay more for their own health insurance, now they're going to have to subsidize the subsidy. So for so many reasons this law is flawed. For so many reasons I still firmly believe that the law needs to be repealed, but it's clear that the president is insistent it remain. Clearly there's no one that can force him to do something he doesn't want to do. But the senators are elected representatives like I am. And at the end of the day, he or she who serves in this role that does not take that title seriously, I believe, will eventually be replaced. And so that is why I'm calling on my constituents who've called on me to step up to do the same to the United States Senate. Because one chamber alone cannot make the necessary changes to allow for some reprieve and some space to be created between the disaster that this law has become and the health care that people want to desperately hang on to. And that's what this bill this week will do. And I'm certain that if the senators deliver on the promise they made when they were debating the bill, we should have enough votes in the Senate to pass this bill this week. With that, be happy to take questions from any of the news media.
Can
or
you
feel free to ask any of our
get enough
participants.
votes that it would be veto-proof, you think?
Well, I was asked that earlier today about a presidential veto, and I remind people that even Bill Clinton vetoed welfare to work 3 times before he finally passed it the 4th time. So, interestingly, the president, knowing this bill is coming this week, has not issued a veto threat. Yesterday, Bill Clinton said that he thought the president should make good on his promise and allow people to keep their health care plans. And I'm betting that more senators will agree with President Clinton than they will President Obama. And I'm willing to bet that it's not just in the 18th district here in Illinois that members of Congress are hearing from their constituents. I'm betting that the senator in Louisiana who's up is hearing from her constituents, and the senator from West Virginia who's up is hearing from his constituent. The senator from Montana who's up is hearing from their constituent. At the end of the day, they have a responsibility, I would argue, at all times, but in particularly senators who are up for re-election.
Such as a senior senator from Illinois.
Seem to listen even better. And so I think we have the potential to get the votes. And the other thing I would say is this. Inaction is not going to make this problem go away. It's not as though this is a problem with the website and 3 or 4 months or 6 months from now, once they get the kinks from the website, even if they can get them figured out, that this problem goes away. The fact of the matter is we are requiring people to buy a product which they cannot afford, and a system that, quite frankly, doesn't work. So that's why the law needs to be reformed, not simply because the rollout had a hiccup or the website doesn't work right now. Anyone else? Yes?
I'm not a member of the media, does it matter?
Well, I'll take one question from the non-media, but if I start doing that, we might be here all day.
Okay, well, it's not actually, I'm a 31-year-old male, single. I don't have health insurance. I don't want it. I don't want the government to make that decision for me. My question is actually directed towards the July 25th vote on the NDAA, or was it the NSA's spine? Why didn't you vote?
That is a very good question. I was with my friend Amy Luton and about 200 of my constituents at the Brazilian embassy. I host a fly-in once a year, and I was across town, and Make a very long story short, I'm embarrassed I missed the vote because I was leaving the embassy on my way back to the Capitol. The amendment you're speaking to is the Justin Amash amendment.
Yep.
If you call his office and ask him, I was a yes on his whip check, so I was intending to vote for it, but I am a fallible human being, and that's why I was not on the floor voting.
Thank you.
Yep. Anyone else?